Hi everyone, I am Dr. Maheshwari, fertility consultant from Oasis Fertility, Ananagar, Chennai. In this video, we just touch upon recurrent pregnancy loss, what next. When a woman is having 3 or more spontaneous miscarriages in the first trimester, that is said to be the recurrent pregnancy loss. Recurrent pregnancy loss is always an emotional burden to both the partners. So before planning out to next pregnancy, we should find out the cause for the pregnancy loss, then they have to go ahead with the next pregnancy. Here the women should know there is no problem with the conception. There is problem only in the continuity of the pregnancy. So that should be found out, that should be corrected, then which can result in successful pregnancy. The commonest cause for the recurrent pregnancy loss is genetic abnormalities in the embryos. So they can go ahead with the genetic testing of the embryos before planning for the next pregnancy. So in case of genetic testing, if it is coming as a euploid embryos, they can go ahead with transfer of the euploid embryos, which can result in successful pregnancy. The other cause for the RPL could be like uterine factor. In case of uterine factor, any uterine abnormalities can cause the recurrent pregnancy loss. That should be corrected if there is any. Also, it could be like autoimmune mediator factor, which could be corrected before planning for the next pregnancy. So always do remember, in case of recurrent pregnancy loss, always find out the solution for it, find out the cause, find the proper solution and get the treatment accordingly. If you have a proper treatment at the right part, definitely that can result in successful pregnancies. Coming on to autoimmune factor for recurrent pregnancy loss, it is said to be the immunological factor. In case of immunological factor, it could be because of the antiphospholipid antibodies or anticardiolipin or lupus anticoagulant, for which we can add medicines like aspirin or heparin, which helps you to achieve the successful pregnancy and successful birth of the baby. Or else it could be like rheumatoid factor or systemic lupus, SLE we used to say, for which there are certain medicines and immunomodulators are there which should be given, which can result in successful pregnancy. So always find out the cause and get the treatment accordingly, then it can be result in successful pregnancies. Thank you.